My name is Sarah Ambrose, and I'm a pharmacist working for Southern Maine Health Care. I use HealthInfoNet for a variety of reasons while working as a pharmacist in a ambulatory care or primary care setting. I am often working on transitions of care projects. Patients that have been recently admitted to the hospital are now discharged from either the hospital or their nursing home, and I use HealthInfoNet to look up their information as far as their admission and their discharge from the hospital, and I'm able to use that to help with post-hospital discharge medication reconciliation. I'm often looking at medications there and seeing where the patient has been at the hospital, what are they actually taking now, and what has been changed and whatnot, and kind of reconciling that for the physicians to kind of make sure we're all on the same page. And that's especially helpful because we have a variety of patients. They come, to our Southern Maine Health Care hospital, but they're also going to Maine Med or some of the other hospitals in the state. So I'm able to view some of those discharge summaries before we're even getting them at the office by looking them up on HealthInfoNet, because unfortunately sometimes there's some lag time before we get them faxed. So that's been very helpful in that process. I just want to give you a story of a case where I had a patient who mentioned that he had had a terrible allergic reaction to a medication when he was at a hospital stay a few years prior. He had no idea what the antibiotic was, and I was able to look in HealthInfoNet and determine from the records that I was able to pull up from the other hospital what the medication had been, because it was actually documented as an allergy in there, and we didn't have it on file. And this was able to help the physician in prescribing for an acute infection that he had at that point. So HealthInfoNet is fairly simple to use. I haven't had any problems getting in. I'm able to locate what I'm looking for, whether it be labs or discharge summaries, medications, anything that the patient has that is available in this resource is very readily accessible. I usually bring it up anytime that I know I'm going to be meeting with a patient that day that I'm doing a medication reconciliation, and kind of keep it up, if I have multiple patients that day, and just open it as needed. I also recommend it to a lot of our nursing staff, and if they're having any problems or questions getting their discharge summaries from outside hospitals, and they easily can, it's usually right there. They don't even have to wait for the fax from the hospital.